Thank you for the question. When you look at CMS and its standards, a lot of the community home-based care services are pretty much left up to the states in terms of being optional. And this is where community health infrastructure comes in. How do we create the comprehensive community health necessary for people to manage their chronic diseases, have access to providers locally, but also then extend pipeline programs to increase the number of providers that can support them at home for their activities of daily living, and then do so really with a supplemental wage program. I didn't answer the last question entirely, but the truth is $20 is not a livable wage. We need to really have a targeted approach around supplementing wages for these areas of these essential areas that we have, and certainly supporting our older residents is an essential area. My grandmother died a month ago. My mother had a very difficult time getting help, and frankly put a lot of stress on my mother as well in terms of her own health and ability to care for herself. We have to really think comprehensively on how we're not only increasing the number of providers, but how we're expanding home health care services to not just be 25%, but really to be 50% of the work that we're doing. I don't know why in this country we've lost this culture, the daily practice of making room for the people who have built the foundation before us. And I think it's going to take a collective effort by young and older people to really rebuild that culture back up. And we can do it with, money, with increasing providers, but programmatically, I think the state needs to make a commitment that it is going to expand its community and home-based programs, and it is going to work with multiple departments like Health and Human Services, Department of Health, as well as Department of Education when we talk about health literacy, and bring this really together. Because in the next 10 years, our demographics are going to change significantly.